So, welcome everyone. I think we'll just get started. I think that everybody is here either in the room or joined online. I'm absolutely delighted to be here to conduct this review and to welcome everyone. My name is Marie Todd and I am Minister for Drug and Alcohol Policy and Sport. I'm MSP for Caithness, Sutherland and Ross, just across the water, so I feel very close to Orkney quite a lot of the time anyway. With me is from Scottish Government is Caroline Mann, who is the Director General of Health and Social Care and the Chief Executive of NHS Scotland. NHS Orkney is represented by David Campbell, the Board Interim Chair, and by James Goodyear, the Interim Chief Executive. So this review is an annual event. It's aimed at discussing how effectively the board has delivered local services in the preceding year and exploring key future developments and challenges. It's part of the process of holding boards to account for large sums of public money invested in NHS Scotland. And I've spent the morning meeting with NHS staff and patients to get an idea of the issues affecting people here in Orkney. This session is structured around the board's performance, national and local. The board chair is going to undertake a presentation. I'll then chair the Q&A session where questions are clearly for the board. I'll ask the Chair and Chief Executive to respond where questions are tricky. I'll ask them to respond as well. I'm a politician. I should be very clear at the outset that it isn't appropriate to answer questions about patient-specific issues in public. These things can be followed up with the board in private after the review. There's no ability for the people attending virtually to ask questions in real time, so the board gave them the opportunity to raise a written question in advance. And I understand a number of them have been received, so I'll put these to the board leadership first, and then we'll take questions from the floor. After this session, I'll attend a private session with the board leadership, and that session will include a more detailed discussion about local performance. And the main points from all of that will be covered in a ministerial letter that we'll issue in the coming weeks, and that will be published on the board's website. So hopefully that's clear to everyone. We've got about an hour, and I'm going to hand over to David Campbell for his presentation.
Thanks, so. Thank you guys, and welcome to the annual review session. I've been in the post for 7 weeks now, but I've been involved in the organisation since 2018, so we've got quite a settled board. So really thank you for the staff for being the main drivers this year of success in really challenging times, and the real constructive feedback we've had from the public to trying to improve our services has been absolutely paramount. I think what I'm going to touch on really is we're looking back effectively from April 24 to March 25 years, so it's always hard to go back a bit in time, but we'll maybe touch on some of the successes, some of the challenges and some of the areas we're going forward. So next slide, please. Just a bit of a reminder in terms of people online, we're obviously going to be recording this, so everyone's happy for the camera to be on, and this will obviously be retained so we can get our notes correct, and then if anybody's got any questions in terms of privacy, there's an email address at the bottom of that slide previously. So, okay, moving on. I think the main areas for last year was resilience, recovery and renewal. Stability and progress is always an aim of a board. Improving our culture has been something we've been trying to aspire to do, trying to get some real consistency in our approach and trying to make a good place for people to work, but also for patients to get experience and high quality service that they require. Stability of leadership was something, again, high in agenda. I know you'll, from last year, you'll see there's been changes, but I think hopefully assurance to you guys in public that we've actually acted quite swiftly myself and James goes into the leadership team, and we've got a director of people culture that's due to come in the coming months. So that's been a good success there. Operational grip and control, something, to be brutally honest, we've maybe lacked in past years. We've strengthened that this last few years to help us on our financial recovery journey, but also our patient safety as well. And you'll see a risk of management is something that comes across our themes, something we've actually had to address and get a consistent approach. Listening to and acting on patients, that feedback, again, something we're really, really interested in improving. Hopefully seeing in the coming slides, that's areas we've really put into our agenda. We've commissioned external review into cultural development, and that's helped us to look at organisational, team and individual developments of how we can improve and be very reflective. And just going back to actually getting the basics right, just listening, responding and acting in a timely manner where we can. Next slide. So our achievements, 24-25, we've put into our areas of our corporate strategy. So in place, we introduced a new chapter in our integrated performance report for population health. Again, an area where we're probably not so strong in the past. We've strengthened that area. We've moved forward on our plans on the Old Balfour and King Street site. And people that read our board minutes will see that we agreed in August this year to dispose of King Street, which is going through a process at the moment, and moving forward with Scottish Government funding to look at surveys and the demolition of Balfour site, which hopefully will help us again when we come to areas of housing further down the presentation. And a huge success story is our completed our work to decarbonise our estate. I think we're the only net zero hospital still in the UK. That's a testament to, again, funding and support from Scottish Government, but also our teams that implementing that across not just our site of Balfour, across the Northern Isles as well. People, again, improved IMATR scores for our staff compared to 23-24. The biggest increase in Scotland in terms of our scoring, up 10%. And a key area was the most improved board for visible leadership. To caveat that, there's areas still for improvement, but that's kind of the main areas that we kind of celebrate. In the people section, again, staff bright ideas, scheme is from strength to strength. When you're looking to create efficiencies, looking to try and get better use of public money and maybe avoiding wastage, staff have come up with the majority of the ideas, to be fair. They know their service, they know the patients, so we've really listened to them to improve where we're at. And then we're kind of the icing on the cake last year was our 3 finalists nominated for the Nurse of the Year Awards. Amanda Manson, Melissa Lindsay and Anne Gregg were all nominated, with Melissa coming away with the Midwife of the Year and Anne Gregg coming away with the Nurse of the Year. So great successes there to show what kind of dedicated, committed staff that we've got. The patient safety and quality experience, the improvements we've made, we've introduced care opinion in the maternity section. So it's basically a kind of an interface for patients to share their experiences so we can actually get really valuable data how we can improve things. A new board assurance framework to help the board identify and manage risk across organisations in a consistent manner. We've got a new clinical governance structure and reporting. We've got a new senior leadership team forum that we've set up that really drives the kind of the decision making below the board and gives us the information we need when we make tough choices. And again, a huge tangible thing you'll see on the shop floor is the MRI being a new scanner that's been in Orkney. Obviously, data-wise, it's only been going a few months, so we're waiting to see how that, but early indications is that's going to be a huge benefit to Orkney, and hopefully we'll be able to keep that on long term. And then there's a few other kind of small kind of granular areas down there where happy to pick up on questions with the relevant executives at the end. That's just some examples of good practice. Performance, I think before we start, obviously, I think we can accept on escalation 3 or 5 and Scottish Government framework there. That being said, in that climate, we've achieved £4 million of savings targets, which is no mean feat, and something that NHS Orkney struggled to do in the past is to actually identify recurring savings, so i.e. money that we can save in the long term. 70% of that 4 million was recurring, which is a huge boost for us. 100% patients seen within 18 weeks in our community mental health team, and also we are consistently a high performer in our 4-hour waiting targets in A&E, which we're one of the top performing boards in Scotland there. Obviously, there's areas which we've got to in a few slides' time where maybe got challenges, but that's kind of the main areas of celebration. And also we've got published summary of waiting times by specialty, something that we've actually taken in this last year, which is really helping us look at the areas of challenge and improvement. So potential, mainly down to advancements in technology. You'll see again, we're looking at rolling out electronic patient records, which we've started. It's not fully completed yet. And upgrading IT systems where we can in general practice, again, to make it more accessible for and more user-friendly for patients, but also to maybe help us with more efficiency within our system. So if we go to the finance, this is the headlines, basically the kind of account section of the report. You'll see our budget is just short of 90 million. Just over half of that is towards staff pay, and the other half is obviously towards clinical infrastructure and SLAs with other health boards. You'll see 16.5 million we rely on other health boards to help us with services, which is quite a big chunk of our budget. Our capital programme is normally approximately £1 million a year. This last year we had £3 million because £2 million was towards the decarbonisation of the properties across our estate, putting up solar panels and putting in insulation across major surgeries in North Isles too. So really helping us to add value to our patients, but also maybe give us long-term sustainability as well. So we'll move on to our challenges that we had in the year. I think you'll probably agree that they're shared with many areas in Scotland. Just adding that rural complexity gives us maybe more challenges than others. You see that the national average for a population of over 65 is 20. We were higher at 25%. And you'll see the kind of the stark figures in the second bullet point that by 2043 there'll be an 86% increase in over 75 in our population, which is going to obviously it's great people are living longer, but we have to create a system within our NHS that actually can handle that kind of level of complexities. Staff recruitment and retention is absolutely one of our biggest issues. I think locum and agency spend, it's quite documented that that's cost us a lot of money. Trying to get people attracted to come in full-time employment in certain areas in Orkney has always been a challenge, but maybe this year looking how we can maybe get more creative in that space to attract the right people. And then onto the areas where maybe we can't control on our own is housing for staff, and that's potentially an area in the Old Balfour site where we can work together with partners to get something that might benefit us long-term for our staff accommodation side. And then the travel to access services of Orkney, you'll see near me, which I would say in COVID we were the highest board in terms of usage of near me. That's slipped this last couple of years, but we've just promoted now a digital by default with Grampian. So anyone that has to go away for treatment, potentially anything that's not necessary for going away, the default is to do it online, and hopefully that will maybe give us a better patient experience and help us sustainable as well. You'll see the long waits. That's our areas that we've struggled for quite a bit. And endoscopy, ophthalmology, ENT and trauma, orthotics is something that we have to kind of get grips with this year. And we've potentially got some plans in offering there, but that's going to be something we'll need extra support. And that's where we look at regional working and maybe some transformation in that space. And then obviously, like I said before, the financial position. So we'll just look at maybe opportunities for next year and what's matched to you, what we've heard in our areas took place, improving people's physical and mental health and well-being, goes without saying, and really concentrating intervention, especially around the areas of smoking, obesity, well-being, areas potentially where small isolated islands maybe struggled. We want to be obviously a population health organisation and prevention, intervention, everything that we do. There is a huge space and opportunity for the reform space in terms of working with stakeholders. OIC, looking at areas where we can work together to share kind of what we're doing, and again, make the public pound go a lot further. Every discussions there at the moment. We've had a couple of conversations with OIC, and we're looking how to progress that in the coming months of areas where we can focus. Patient experience, safety, again, it's down to consistency, it's down to fostering a strong culture, and it's really to listen to the clinical voices and our patients going forward. Something that we've started this year with really good results, but we need feedback, we need patients to come and tell us the good stories and the bad stories, and that's the only way we're going to improve. People, again, we've launched our overarching experience programme. We've also an employee journey, listened to areas of concern where we can improve that, and also we've just about launched our behavioural framework to try and get a consistent culture for our staff and our patients, how we talk to each other, how we treat each other, and how we work together to get a far stronger culture. You'll see the main areas of focus is appraisal rates, mandatory training, and sickness absence areas that we have to improve. Again, it's shared across Scotland. And we've got really great people in our organisation that need the support and need the skills to be able to do future roles for us. And we're looking at ways we can support that as well, because trying to recruit people in certain areas and certain levels where you're competing with other NHS boards, or even a small rural area, it's really challenging. So growing our own and getting people the best chance to succeed is something we're going to concentrate the year going forward. Performance, again, delivering our financial plan and continue our path of de-escalation. As you expect, every year when you've got a really challenging financial savings target with a small budget, every year it becomes harder. So finding ways to improve that is a huge focus of us. And we're currently on target there to hopefully continue the good work. Improve access and reduce waiting times. We've got plans to have no one waiting over 52 weeks by the end of March 2026. But we do accept there's areas where we still got a huge challenge, and that's where we're putting our attention to. And one kind of area was trying to get our discharge experience better. We've had examples of people not having the level of discharge, especially in Northern Isles, where they expect. So we need concentrating on that kind of area so it's consistent and it's patient-centred. And my last slide, which I had to know, is on potential. So again, it's looking at digital maturity. I think we've kind of really accepted we're immaturity in the digital sense due to a small organisation. We've got small teams, but we've got great ambitions there. Looking at educational training improvements, so looking at an on-site education improvement centre, that's something we'll hopefully in the next year or two implement, and revisiting our clinical strategy that we put so much time and effort in from not just our organisation but from a community, seeing what's important, what needs to change, and using that as a real kind of Bible going forward of how we can improve things. So thank you.
Thank you very much. That's really great. I think that's a really helpful context setting as we move on to the Q&A. So we've got 4 written questions which have been received. They've been anonymised and summarised as follows. So the first question is about the redevelopment of the old Balfour site. Specifically, the questioner points out that the site is surrounded by residential properties and is looking for an assurance from NHS Orkney that they'll meaningfully engage with local residents about the plans for the site. So I don't know which one of you would like to take that.
I think, Mel, are you happy to take that one?
Yeah, thanks, Dave. I could take that one. So, yeah, so absolutely, we will communicate, engage with the resident.
Volume up, so.
Oh, can you not hear me?
Finance.
Can you hear me now?
Yeah,
yeah. So I'm Melanie Barnes. I'm interim head of director of finance. So yes, absolutely, communication and engagement with residents will be paramount to this. So just to give a bit of reassurance, we're at very early stages of the tendering process for the pre-demolition surveys for the old Balfour, and these surveys will determine what's on the site so that we can demolish it safely and securely. I would expect, given tender process, that the pre-demolition surveys would hopefully go ahead sometime between January and March of next calendar year, depending on the winter weather, and demolition probably around June to August, maybe next financial year. But certainly once we've got some confirmed plans, those will go through the normal communication, and we'll make sure that affected residents will be engaged and know exactly what's happening.
Many thanks. The next questioner points out that there are unacceptably long waits to access community mental health services in Orkney and across all of Scotland, and asks what's being done about this. So I'll maybe start, and then one or the other of you can join in. So first of all, apologies to anyone who's had to wait too long to get access to the treatment that they require and have a right to. I can assure local people that the appropriate access to high quality mental health services remains a priority for the Scottish Government, and there's been, I suppose, over the course of a number of years, an increase in demand for these services, which is why we've invested 160 million nationally since 2020. We can demonstrate real progress across Scotland as a result of that investment, including significant and sustained progress in achieving the 18-week standard for child and adolescent mental health. I think it's been met for the third quarter in a row nationally, and 12 out of the 14 territorial health boards, including NHS Orkney, meet that 90% standard. We've also exceeded our commitment to fund over 800 additional mental health workers in A&E departments, GP practices, police custody suites and prisons across Scotland. I know that NHS Orkney is working really hard to reduce waiting times for patients who require these services as part of the national investment, whilst recognising some of the overall challenges in staff recruitment and housing pressures locally. I was heartened to see, I think you said that people are waiting less than 18 weeks generally for access to community mental health services. Hear a little bit more about the local situation.
I might pass on to Stephen Brown, Chief Officer at Occupation Shut North.
Yeah, thanks, Minister. And a bit like Scottish Government, this certainly remains a significant priority for NHS Orkney, recognising that we have, like the rest of the country, a large number of young people and adults at times who struggle with their mental health and well-being. I'm delighted to say that over the past year and a half, certainly the 18-week targets for child and adolescent mental health services have been consistently met, albeit recognising that 18 weeks is a long time in a young person's life to wait for services. And certainly that picture is the same with our psychological therapies. We continue to meet the targets very effectively. However, there is no doubt that we still have some significant pressure on psychiatry as a resource. I'm delighted to say that over the last month or two, we have now increased our psychiatry resource to 1 full-time equivalent. That's 2 part-time psychiatrists who are dedicated to Orkney, and we continue to work our way through those waiting lists because it is unacceptably long at the moment. And the final thing, just to say, in relation to access to community psychiatric nursing, the average wait at the moment is 6 weeks, which is a much better picture than it has been previously. And that's been some of the internal work that we've done in relation to triaging and referrals and making sure that where there are real emergencies, people are seen as quickly as possible.
That's very helpful to hear, Stephen. The third question asks, is cancer health care in Scotland ageist, leaving elderly patients to experience age-based biases, assumptions that they may not want treatment, and a lack of a holistic approach to their care, particularly those with comorbidities? I guess the first thing to say is we have to recognise the challenges and the complexity of some of the decision making, but I think it's really important that all of us guard against any bias, whether that's age related or not. My understanding is that the Scottish Cancer Patient Experience Survey from last year showed generally a very high levels of patient satisfaction with an average care rating of 9 out of 10 and 96% of respondents saying that they have been treated with dignity and respect. But there were some gaps identified, with some patients feeling like they weren't as involved as much as they would like to be in discussions about their care and treatment. So there's more work to do. And I can assure you all that the central theme that runs through Scottish Government policy making in health and social care is the pursuit of high quality, patient-centred, and I was social care minister, so I liked patient-led, person-led care. I think we've heard in some of the sessions this morning, particularly the patient on some of the extra challenges that there are for an island health board in making decisions. And one gentleman told us about his 3-day trip to the mainland for healthcare, and I can imagine if you're elderly and unwell, the burden of all that extra travel and logistics, definitely I can see that might be challenging. But those decisions need to be made with you, not for you.
Maybe pass to Anna, everything locally, you know?
Yes, so I would like to celebrate and also to highlight actually our services that we have on Ireland, and to particularly call out the Systemic Cancer Care, which works very closely with Grampian, and certainly we have links with them both in terms of diagnosis, treatment, but also on the day matters around. And we use support. Sorry,
We can't hear at this end.
apologies, right on. I really wanted to celebrate actually our cancer services within Orkney, and specifically the close working of our systemic anti-cancer treatment unit that we have within Orkney, which then avoids people having to travel to Aberdeen for that treatment. In terms of supporting travel, we do support people to travel, and we try and work out the best ways and easiest ways to travel, and if necessary, for people to travel with to Aberdeen as well. So I think to address the specific question around sort of age-related care, we can really celebrate the care provided within Orkney, and that's borne out by our performance against 31 62-day standards, recognising that these are very small numbers, frankly, within Orkney. We're often able to achieve higher levels month on month in other areas in Scotland, mainly because actually our team is very integrated and able to track individually and get to know these people that have these diagnoses and really work very closely with. Can be quite difficult and challenging times both for them and their families. So I think this is something we can really celebrate with Orkney.
Thank you very much. The final advanced question, which is actually linked to the last one, asks whether in NHS Orkney there is access to holistic geriatric service for elderly patients that can understand the complex issues facing them and their families when they're diagnosed with multiple conditions.
That's what Anna did.
Thank you. So during the year that we're looking at, which is 24-25, we introduced a comprehensive geriatric assessment pathway, which is part of good practice. It's recognised for Orkney, and while we do not currently have a substantive, so an employed consultant, it's a geriatrician, we're grateful that we do have somebody that's based on Ireland that we employ on a locum basis, and that we can try who does bring those specialist skills and support. Recognising that with Orkney we don't have nursing homes, we don't have homes in the community that can provide that kind of specialist support. So we do, by necessity, provide more of that service from the Balfour. I think particularly to look forward as part of this year's work, so that's more about where we're going. We're looking at how we can move that temporary basis of geriatrician into a more substantive, sustainable model of geriatric care.
Thanks. Do we have any questions from the floor? Yep, go on.
I'd like to thank the Minister for allowing me earlier to attend the patients group, and I'll try not to repeat what I said previously. So going on, I was interested in the slides. You were speaking about stability of leadership. And I'm wondering, you know, there's a lot of interim posts, and surely to move on from there would be the first move in getting stability of leadership. And I'm wondering if we can get timescales for full-time appointments. And I can also put in one more on waiting times. You're listing quite a few. One, which is the issue for bone scans. And at the moment, I understand that the mobile bone scanner, which used to come to Orkney, is now unserviceable. And obviously, this is going to increase waiting times for people waiting for bone scans. And I know of several who are over a year waiting. And I'm wondering what the plans are moving forward to perhaps replace the mobile bone scanner, or what is the situation there?
I can answer the first question. I'll pass the second question to the director. So in terms of substantive roles, there's three currently. So obviously the interim director of finance, Mel was on call this year, seconded from Scottish ambulance till March 2026. So we'll be looking at substantive recruitment in the coming months. James, our new CEO, he's here up to 12 months with us. So again, in the next months, we'll have to sit down with James and look at timescales and go substantively for that. And my position will be going up for Christmas as well, or around Christmas time, because my years is up in the 4th of June next year. So we'll have that 3 positions in the next 6 months will definitely be addressed. Exact timescales I can't give you, but the coming months will definitely be addressing it. And second question, I'll pass on to Anna, our medical director.
Thank you very much. And I do appreciate the question on bone scans and recognising it's a challenging situation across all boards. Because this is a service that we've been dependent upon Grampian providing, you're right, it has led to very long waiting times, particularly for the year that's concerned. I'm happy, though, to say that we have recently reviewed the suitability and usability of the van, which is tours across the island. It's not our van, and actually been advised that we can now restart using that for bone scanning. So we expect within recent months before Christmas to be restarting the use of that for providing bone scans within Orkney.
Good question. Any other? Yes.
Could I ask the board if they've ever considered fining people for not turning up for their appointments? I think nowadays, I mean, there's a lot of people that can't get appointments maybe for 6 weeks seeing a doctor. And lo and behold, there's folk don't even have the decency to turn up. So I think you should be fined at least £20, being a conservative man. And I would like to know what the board's views on that is.
That's probably a political question.
Well, that's what, no doubt you will give us a spin doctor's answer. You're very good at that, these politicians.
I think, so I worked for 20 years in mental health before I came into politics. And many of the people who find it hardest to navigate our system and the most challenging to navigate quite a complicated system that we set up for them would be mental health patients. And I think that fining them probably just would mean that they would disengage rather than encourage them to engage. I recognise the issue that you raised. Will we lose a lot of money to people not attending? But my answer would generally be to try and make it easier for them. Years and years ago, my local GP practice did a quality improvement session where they looked at their DNAs, did not attend, and they came up with a scheme to only enable people to book quite short term ahead. Now, this does not suit me. I'm somebody who has a diary that's full for months ahead, so I quite like to make my doctor's appointments for a year ahead, but I can't do that anymore. But actually changing that system so you couldn't make long-term appointments far ahead and you could only make them in the next 4 weeks really reduced the number of DNAs. So I guess what I would say is if there are a high level of DNAs, you need to get under the skin of why that is. Is it people with really complicated lives who are unable to attend at the times that are given? Sometimes it's about transport, people can't actually get there at the right time. Sometimes it's about having complicated lives and not remembering or needing support or having really challenging, chaotic lives. Sometimes it's because, I mean, certainly in my constituency, it's very often the letters aren't arriving. So something's happened to our mail nowadays that is making things very difficult. So I think you need to try to understand why people aren't appearing and then make it easier for them to do so. I had myself and my husband both had the flu vaccine. We both got called this year in NHS Island for a flu vaccine, and both of us had to change our appointments that we were given. My husband found the experience very, very straightforward, and he's had his flu vaccine. Because I work in a different part of the country to the one I'm registered, found it very difficult. I have finally managed to make a flu vaccine appointment, but there's all sorts of reasons why people find it difficult to get things at the right time and to attend with the service that's provided. So I wouldn't be for finding them, frustrating though it is that people wait over time.
But with respect, you always get a reminder, a text message to say your appointment's on such a date, and you get another one. So there's no excuse. That is just waffle.
So some people don't have, my dad can't use text, for example. So my dad wouldn't get that. He's not signed up to get text from the health service because he can't text. So there are a whole swathe of people for whom that would not work. I've certainly had texts about appointments when I've never had a letter. And I've been down in Edinburgh and I've had to try to find a number to call to say I'm not going to be able to make that appointment, which has clearly been designated to me but never communicated to me. So I think we would have to have the system working perfectly before we start charging patients.
James, before.
I don't really think there's anything to add to what the minister said.
I think we're really working again on other areas that was told. We are trying to roll out our text reminder service too. So in the coming 12 months, that'll be a far more sophisticated service we have now as well. Hopefully that will help us. Sorry, Anna.
And if I'd just like to come back again, recognising that last year we've been doing quite a lot of work coming forward this year in terms of making it easier for people to get to appointments and to change those appointments. And one of those is the move that we're trying to do, which is moving to a digital first approach. That doesn't mean you can't have an appointment in person, but it should mean that you should be offered an appointment and to be digital wherever possible, rather than having to travel down to Aberdeen. And I think one of the things we have to particularly notice that for Orkney is that for people travelling from the more distant islands, that actually getting to appointments, as has been said, can often be a 3 or 4 day type journey if it's not about popping out in the middle of work. So I think there's some particular challenges for Orkney, and certainly given the weather and travels that are over the weekend, we certainly wouldn't be in a position to be wanting to find people because the weather's been.
Any other questions?
Communication between departments sometimes is very bad. That you go for a test and then you maybe go to the doctor, they don't seem to have your answer. You go round the block trying to find out where your tests are and the results. And this just adds to the stress of people. They're worried enough because sometimes you have long waits for results, sometimes maybe 6 weeks, sometimes more. And you speak about mental health. With this, I think, increases mental health as well.
Yeah, absolutely. So I think you're absolutely right in that issue, and that issue's been raised with us already this morning. Clearly, it's clearly there are challenges both within the health service in Orkney, and because Orkney's an island board and has to liaise with other health boards with accessing tests from other health boards as well, and we need to improve that. It needs to be safer, and it needs to be person-centred. It is really stressful waiting for results. I find it very stressful engaging with the health service altogether, and I'm a health minister and a health professional. So the last thing we want is for you to be having to wait to access results, which, you know, could, a lot of people say within that engagement with the health service, that sometimes it's the unknown that's terrifying. Once you know what you're up against, and you may not be up against anything, you can get real reassurance from some of these test results, or you can find instead of it being the frightening unknown, you can understand the reality of the situation that you're in and start to work through options. We need it to happen as quickly as possible, and it's very frustrating for people when they can't get access. We'll try and improve that for sure.
Yeah, and I think for ours internally, something to work on in terms of our own teams, but NHS we have SLAs with. I think having plenty of anecdotes of saying, I don't know if I'm an NHS or your grandparent patient, I don't know where this stuff comes from. So work with the SLAs, work with these guys to actually strengthen that communication is something we definitely have to work on, because that's not up to standard that we should be at the moment. And at the moment, I don't know evidence. I don't know of anyone excited as James want to come in terms of how we improve that area.
Yeah, I think that's right, David. Just to say that locally we're looking at how we can use our electronic systems to improve communication between the hospital and general practice, particularly including around results. And there's also work that's going on nationally to give people greater access to health services using an app on their mobile phone. And that'll be coming to Orkney either later this year or next year, which again should give greater visibility over things like access to results. So we, as colleagues have said and the Minister said, recognise it's not as good as we would like it to be at the moment. So at the time, we're absolutely committed to trying to improve that.
Thank you.
Any other questions? Yes, go for it.
It's like something which came up previously was on complaints procedures. And it's really more on feedback, I would say. Quite often, you know, the hospital, I think you have a complaints officer. I'm not quite sure that's not the right title for them, but they have someone you can contact and speak to. When it comes to issues with GP practices, quite often there's not their complaints procedure tends to be to speak to the doctor or speak to the practice manager. And some people are wary of doing that, especially in a small community where they think, well, word gets round and they're frightened of an effect of them complaining. And I'm just wondering, is it possible to consider having a complaints officer who would cover the GP surgeries and hospital, so as a person could, perhaps it might not be a complaint, it's just feedback that they could contact without worry of being, I shouldn't say targeted, but being identified?
Pass over to the others. First thing I would say is that complaints are generally welcome, good news or bad news. This is the NHS in Scotland is an organisation that wants to learn, and patient feedback helps to learn and helps to drive improvement. And if there is one thing that everyone could take away from this today is exactly that. I recognise, and I've heard many times before, that concern about raising complaints. There is an inherent power imbalance when you're dependent on someone to take care of you. It's very hard to then criticise, isn't it? But it's really important that we hear the hard things as well as the good things to try to improve. Everybody who works in the NHS comes to work because they want to make their lives better and they want to do a good job. So any feedback that can help them to do better, I think, is very welcome. The challenge with GPs, and it's not insurmountable, but GPs are independent contractors within the NHS. So I think that's why there's a slightly different process with GPs as compared to the services that are delivered by people who are directly employed by the health board. But let our local representatives tell you a little bit more about how that works.
Yeah, I'd say it's a difficult one because we actually, we welcome complaints. We always just get an annual report of the complaints, and we always wonder as a board if low numbers, good or bad, i.e. is people not actually complaining or having a good service. So we start to go more to live data in boards, so we're actually starting to look at that more regular rather than looking 12, 18 months back. But really, I think the main thing for us is how do we treat people when they complain? How do we treat them with respect? Like you said, anonymity, making sure people can come to us and feel confident. But in terms of the system you're talking about, in terms of potentially integrated, I think Ms. Todd said about the complexities with the private practices, but I'm going to pass on to some executives and I do.
Thank you very much. So I'm medical director and I'm responsible for managing the patient safety, quality and experience, which includes feedback. And I'm probably going to talk about feedback rather than complaints, because we do encourage people to speak to us both about positive, negative, or even actually just suggestions for improvement. So we're really welcome. And we've just come this week, we've just moved out of Speak Up Week, which was last week, which was across the NHS, which is encouraging staff to speak up and provide feedback in all circumstances. So as Todd has spoken, that GPs are independent, and so it's quite right that they consider any feedback that they receive. And while we're very welcome to receive comments and feedback about GPs, we will, in the first place, if we do receive that within the hospital, we will hand that and pass the general practice for comment on that. We have to recognise sometimes actually feedback is quite complicated and it involves maybe not Stephen hospital here, but actually hospitals in Highland or Grampian, and general practice. And where there are those more complicated feedback or complaints, we will try and manage those as a hub situation. So it isn't just a case that we hand that to the GP and we don't see anything more of it. Where there is that more combined, we do have that combined response. I do want to highlight something we do in Orkney, which is a bit different, and I think we really value here, and that we have our annual reporting, and in fact our quarterly reporting of our quality and experience for our board isn't just limited to the hospital. And we're very grateful for our GP colleagues and the practices they do actually summarise, and they provide details of their own complaints and their experience reports back to the practice. So we do also get that information regularly back to us, which is not something that all boards are able to actually compile. And we then share that, which is presented to the board, and that is available then publicly, so it is published as well. So that's we're being more transparent about that. And actually, I think we need to call out that Orkney does particularly well on being transparent.
Thank you. Any other questions or points you need? Okay, so I hope everyone has found it interesting and worthwhile. Many thanks to everyone who's attended, both virtually and in person. Many thanks to the board's leadership team and to everyone who's been involved in organising today's event. Often complex, but it's really lovely to have this opportunity at least once a year for the public to directly question the board leadership and government. As I said earlier, I will summarise all the key parts of our engagement today in a letter in the coming weeks that will be published on the board's website. So look out for that, and thank you everyone for joining us. Thanks very much.
Thank you.